Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is tobacco and alcohol content in top Vietnamese YouTube videos, a content analysis. Our guest is Dr. Thao Tran, who is a postdoctoral fellow for the Global Tobacco Research in the School of Public Health at Georgia State University. Dr. Tran received her undergraduate degree in public health from Hanoi Medical University in Vietnam and her master's and doctoral degrees in public health from the National Cancer Center, Graduate School of Cancer Science and Policy in South Korea. During her graduate studies, her research focused on identifying the association between behavioral risk factors, including smoking, drinking, physical activity, overweight and obesity, and other chronic diseases and cancer outcomes. Since 2019, she has been working at the Center for Population Health Sciences, Hanoi University of Public Health in Vietnam. While there, her research has revolved around tobacco control efforts in Vietnam. She joined several large tobacco-related projects in Vietnam with funding from the Vietnam Tobacco Control Fund, Ministry of Health, the Union, the Canadian Institutes for Health Research, and the U.S. National Institutes of Health. During her postdoctoral training at Georgia State, her experience has extended not only within Vietnam, but also in a global context, with work covering cigarette taxation, smoking cessation behaviors, e-cigarette use, and vaping quit attempts, perceived harm of tobacco use, tobacco consumption with ethnic minority populations, transitions and patterns of concurrent use of conventional cigarettes and e-cigarettes, the marketing of tobacco products on social media platforms, and the application of novel methods in data science and tobacco control research. Finally, she has presented her research at domestic and international scientific conferences and published 23 peer-reviewed articles, on 9 of which she is the first author. So today's webinar will be guided by 3 general questions. What are you doing? Why is it important? And how can we get involved? A quick note, if you have a question at any point during our conversation, please feel free to type it into the Q&A box and we will try our best to answer. So let's begin. Dr. Tran, welcome to the webinar. Please tell us about your research. What are you doing and why is it so important?
Thank you so much, Brian, for organizing this webinar and giving me the opportunity to briefly introduce my research to everyone. So as you know, tobacco is the single most preventable cause of death in the world. So tobacco kills 8 million people worldwide each year, and mainly in lower middle income countries, where 80% of smokers live. So at School of Public Health, as you mentioned, I am one of the 6 postdocs on global tobacco research from low and middle income country. And here we are provided the training in global tobacco science and policy. And after that, we're going to come back to our home country and contribute to the tobacco control policy. So my presentation to date is one of my work during this fellowship. I'm so excited to share with you the tobacco and alcohol content in Vietnamese YouTube music videos, a content analysis.
What you gonna do next about that time? We can smoke a blunt and pop a bottle.
So there are 2 songs with more than 100 million views of 2 famous singers in Vietnam. So the second one here that you see, it is a collaboration between a Vietnamese singer and Snoop Dogg. It's a very famous rapper in the US. So I have a question. Have you ever seen any of tobacco or alcohol content in the music video? I bet you all seen it at least one before. So however, you may not know that the scenes showing the tobacco and alcohol contents like this indirectly and silently encourage these unhealthy behaviors. The evidence indicates that tobacco and alcohol content in music videos may reduce the perceived harm, increase the susceptibility, and initiate the tobacco and alcohol use among adolescents and young adults. And however, the previous study have mostly assessed the tobacco and alcohol content in English music videos within the Western country. And therefore, they are the research on the music in non-English languages. And in Vietnam, with 65 million social media users, and YouTube is a predominant platform for sharing the music videos. Also, Vietnam is the top country in the world having the highest smoking prevalence and also alcohol consumption. Therefore, we conduct this study to investigate the tobacco and alcohol content in top Vietnamese music videos and also describe other features that related to this content. Let's move to the mental part. So we included top 40 and 50 most viewed the music videos in each year from 2013 to 2021. And this music chart is available on YouTube. And finally, 410 music videos were included for analysis. There are four main pieces of information collected in this study. First, we collected the information such as song name, release date, ranking of the songs, etc. And second, we also examined whether tobacco or alcohol were mentioned in the lyrics. This is the main focus of this study. We collected the information regarding the tobacco content, including the image of tobacco products, image of tobacco use, and a specific tobacco type such as the conventional cigarette or cigars or other brands. Like brand and logo of tobacco products were appeared in the music video or not. And among those music videos contained the smoking or vaping scene, the number and age, gender, and role of smokers were collected. The tobacco portrayals was also described, and the presence of warning about tobacco harm were noted. Here's an example from music videos. This image shows tobacco products which is not used. This one shows the tobacco, using the tobacco, and we also described tobacco portrayals. For example, the first one was shown at bar and pub, and the second one was shown in sex scene, depicting someone after breaking up, something like that. And this image shows the warning content about tobacco on music videos. Similarly, this information relating to harmful content were also collected. Here's an example. This image shows a beer bottle is we're not drinking. And the second one showed a wine of glasses, as you see. And this image shows the scene of drinking. And how we conduct the content analysis, we have 4 coders who are native Vietnamese smoker. And before coding, we have a comprehensive 2-hour training session. And after that, we assess the inter-coder reliability of pair coding in 41 music videos. And if the kappa index is higher than 0.7, the reliability will be achieved. Therefore, the many music videos were distributed equally among 4 coders for independent coding. And all the data were coded and managed using Red Cup. And let's move to the result part. As you can see, this one, the large proportion of pop song was included in this study. And the music videos were performance, dance, or narrative-based music videos. The prevalence of music video containing the tobacco and alcohol content show fluctuating pattern over years, as you can see here. And there was an increase from 2013 to 2019, and followed by a decrease in 2020 and 21. So contribute to this increase could be marketing strategies by tobacco or alcohol industry. But like in contrast, this subsequent decrease can be attributed to the impact of COVID-19 pandemic at this time. Because at that time in Vietnam, the several music videos related to the COVID-19 pandemic went very viral on the internet. And also because of this pandemic, the number of narrative-based music videos is much lower than the period before the COVID-19 pandemic. However, to validate this chance, we're gonna need more further study. And here is the main result of this study, that there was 3.7% of music video contained image of tobacco products. And 7.6% showed the tobacco use. And in total, around 9% of music video have tobacco-related content. Among these videos have the tobacco-related content. Around 77% show the conventional cigarette or backup cigarette. It is consistent with the smoking prevalence, where the cigarette is the most commonly used in Vietnam. And these scenes were mostly showed at the party, bar, or pub, is also during the dancing or singing scenes. Smokers in the music videos mainly are men, which is also consistent with smoking prevalence. There are very high smoking prevalence in men in Vietnam, around the 45%, while this number is very low in women, only 1%. The smoker in music videos mainly at young age, and nearly 40% of smokers is singer. Additionally, like smoking appears to be solitary behavior because more than half of music videos showing the scene of one person smoking. For the alcohol content is more popular. Like in total, 33% of music videos showing the alcohol-related content, with more than 20% depicted the scenes of drinking. And very high proportion of music videos showing alcohol images in party, bar, or pubs. And it's frequently involved in groups, like among young adults and in both sex, as you can see here. It can reflect the social behavior in Vietnam that we usually go out for drinking in group among both men and women. And around like very high proportion, 60% show the singer drinking. This slide shows like 2.8% of music videos show the brand or logos of tobacco products, while this number is much higher for alcoholic beverage. It's nearly 20%. And most of tobacco and alcohol content was depicted in the music videos without any warnings. And in Vietnam, we have the regulation that restrict to show the tobacco and alcohol images in seminar, theater, and television. However, there is a loophole in Vietnam law that the music video is just recorded video, not released in the form of the tape or film. So it's really difficult to apply the above regulation. So, it can be only attributed to the management of activity on the internet. But right now in Vietnam, we have no regulation that we can control those kind of content, unfortunately. And because the tobacco and alcohol content were quite common in Vietnam, around like 1/3 content alcohol content, and nearly 1 in 10 content the tobacco content. So most of tobacco and alcohol content right here depicted in music videos without any warning. Why many singers have millions of fans, and including children and adolescents. So therefore, the music video should be regulated. Therefore, for this study, we have recommended like the government should also consider implementing framework convention on tobacco control requirement on the internet. And like for other company, YouTube might introduce policies such as the labeling, warning, or age restriction on the tobacco or harmful content, which is similar matter to their policy on their sensitive content such as sexual content or suicide, which they already done before. So here is all my presentation for today. So thank you so much for listening. And I hope that it's helpful for everyone who attends this seminar.
Well, thank you very much, Dr. Chun. And so my first follow-up question is just, how can those of us on the call today or on the webinar today learn, be able to partner with you possibly in your work? How can we get involved in this type of work?
Oh, yeah. It's really, really interesting question. Like, I think based on the finding of this study and the evidence from the previous research, I wanted to highlight the appearance of tobacco and alcohol content in the music video is not simply about depicting the product or actions. Like everything you see not only in music video for this study, but also in social media or other like websites on internet that could be involved by the tobacco and alcohol industries. So you may know that they have invested $1 billion in direct and indirect advertising, promotion, sponsorship to attract people to their products. So therefore, if you're concerned about public health, be very cautious and don't fall into the traps that created by the tobacco and alcohol industry. And keep in mind that drinking too much and smoking are very harmful.
Mm. And actually, that goes really well into a question that was just asked from the audience. They were saying that you've looked at analysis of these music videos, and would you expect similar results from analysis of YouTube and Instagram videos? And that might just be a broader sort of question, but kind of what you were just saying about social media. So would you expect similar results?
Like for example, the videos in Instagram is quite broader than this research have been conducted, but it's really good idea. But you should concern about how we can select the music videos on Instagram. How we can do that?
Hmm.
Like, it's just like they have the millions or billions of music videos that posted in Instagram. So how we can select it and detect it? Maybe you can apply very novel technique like machine learning or something like that. It's a really good idea, but it's gonna take more time, I guess.
Hmm. Gotcha. So that kind of segues well into my next question. What are the limitations of your research, and how would you like to expand upon it?
Oh, the study like including only top music videos on the YouTube. So, like music videos can post anywhere, like on Instagram or Facebook or Spotify, right? So, yeah, it's a one kind of limit study. And we also we did not identify the characteristic the individual who view the music videos and
Hmm.
how they expose to tobacco and alcohol content. So therefore, the further study is needed to investigate how people expose to this content and how this content can impact to their perception behavior that relating to the smoking and drinking.
Hmm. So have you been able to determine if the sponsorships from alcohol and tobacco companies are playing a role in these music videos, or if it's the artists who are choosing to display this content independently in the videos?
Yeah, unfortunately, yeah, in this study, we cannot determine the sponsorship because there's no such information mentioned in the music videos.
Hmm.
As we like during the coding process, we didn't see any information like that.
Hmm.
But in some case, artists accidentally including those things because just want to reflect the social behavior on their music video, right? But we also can anticipate that the financial interest may exist behind the scene because around like 20% music video show the brand or logo alcoholic beverage. So why that? I think something is behind. So I highly doubt this.
Gotcha. And you alluded to this next question a little bit in your presentation, but I just wanted a little bit more clarity or make sure that I understand. So do international companies like YouTube displaying videos on their platforms make regulation difficult? And if so, what policy recommendations would you suggest? I think you hinted at that, but I don't know if you want to expand upon it.
Okay, like especially for the country like Vietnam, where the tobacco control regulations are still very limited, it's like different from the high income countries. And to date, we don't have any regulation to restrict those kind of content on the internet. It's very big challenges, seriously, that we cannot even think how we can do that. But if like the international company like YouTube can introduce policies such as the age restriction or labeling those kind of content that's similar to other content that they already did, like suicide or sexual, to really make the great impact on society. It's not only on single one country, it can be like multiple countries around. So it's really a good idea And I hope that they're going to do it soon in upcoming years.
Gotcha. So we might have a few people that are on the webinar today or might find this video in the future who are students interested in your work. So what advice would you give to a student interested in pursuing your type of research and a career like yours?
Actually, it's really interesting question. Like, I know I recognize myself as a very young researcher, but if I want to share my advice, so I would like to, suggest them to find a research topic that they like and to be curious about that. Like just like me, for example, this research study came up to me while I were watching music video on YouTube seriously, and I'm just curious. So tobacco content is predominant in Vietnamese music videos, so that's why I come up with this research. And once you know what you want to do, and even though if you don't know how to conduct this kind of study, please don't worry about that. Just discuss it with your friends or your mentors, and you can learn how to do this with support from others around you. So, just keep learning and be curious.
I like that. Great. Yeah, be curious. It's always good. So my final question for you is, where do you see your research in the next 3 to 5 years?
Yes, as I mentioned earlier to you and all of you, like I will return to my home country, Vietnam, and I hope that I will be an expert in the next 5 years and who gonna provide strong scientific evidence and advocate for tobacco control policy for the government in Vietnam. It's my dream too.
Yeah, great. And we did have just one more question pop in from the viewers or attendees today. It says, in your opinion, that the videos, wait, is it your opinion that the videos reflect the existing reality or are intended to shape a future reality?
It reflects the current situation about this social behavior in Vietnam. As I mentioned with you before, like smoking prevalence is very high among men, it's very low in women. That was reflected in music videos. And for the for drinking, it is like the social behavior that everyone can drink it, even women. So it want to show in the music video too. So it's like truly reflected on music video. I think the reason is they want to show like somehow social behaviors on their um, the music video that they want, go closer to audience.
Gotcha. Well, that's all the questions I have. So I want to thank everyone for attending today's Currents of Public Health webinar. And I also want to thank Dr. Chun for participating in this informative conversation. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree, and 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you'd like more information about our programs and how to support the school's work and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Chun, and thank you for attending. Our next Currents of Public Health webinar on March 28th. Our guest will be Dr. Harry Hyman, who is a clinical professor in the Department of Health Policy and Behavioral Sciences. We'll see you next time. Have a good day.